Hello and welcome to the Ascend Health Show. I'm your host, Nick Angelis. I'm a nurse anesthetist and one of the owners of Ascend Health Center, and I'm here with Mike Scaparato, Doctor of Chiropractor. How are you?
Hey, doing well, Nick. Thanks for having me on today.
So we're supposed to talk about custom orthotics and quantum integration, and we might get around to that. But both of us were like, you know what, let's talk about pain. And the reason I thought of it was I went to the dentist today, and I don't mind the dentist because when I was 5, they let me get into the treasure box and I got a free toy. So ever since then, even though I'm 40 now, I'm like, it's not a big deal. I get a toy out of it.
Hey, you know something? That is a very good way to get people to come in. And it's amazing what will make people come in when they're in pain, whether it's with their teeth or with their spine or any other aches and pains they may have. Yeah,
and it ends up being psychology. In fact, I do have my toy from the dentist, which was a really good one. I don't think it's gonna work though, because it had a bend in it, because I felt a little bad about taking kid toys if...
Right, happy Friday, get some bubbles going, right?
This is the reason also why I need to have these shows here in the studio, because otherwise I'd be complete nonsense all the time. So we'll put that down so I don't get distracted.
Right.
So my main point was that because I associate something painful with something good, it never became that, oh, I have to go to the dentist. And I read an article saying that chronic pain is a uniquely American condition, that other countries don't really suffer from this, which I thought was ridiculous. I was like, well, no. When I was growing up in the late 90s, anorexia was everywhere. Like any time a teen was troubled, that's what they would do. They would not eat. And eating disorders are still a thing, but it's not quite the focus that it was then. And then there's other cultures where, like some of the Latin American cultures, where in Pacho we're having like a bolus of food that you can't digest is an actual disorder that they treat with various maladies. So I'm not saying for the show today that, hey, your pain's in your head, relax. But still, there's an intense psychological component to the way that we feel things.
I agree. Now that it seems like you touched on, most areas and regions of the world tend to have their own things that they deal with as a culture and as a whole. And pain seems to be one of the biggest ones and is a big problem here in the United States.
Right. So, and sometimes it seems to be gender specific, where obviously women have a higher pain tolerance since they're the ones that create all of us. But at the same time, most of the guys that I see at my clinic at Ascend Health Center that come in for pain, someone dragged them there and they should have come years ago. While a lot of times the psychological, physical manifestations of fibromyalgia or some of those nerve disorders are almost exclusively women. So again, not to make this show controversial for the sake of being controversial, but there's so many different facets of like, what is pain? How do we interpret it? So what do you do when someone comes and says, oh, maybe I have back pain, it just feels weird? Like how do we make that step of, let's start with a conservative approach and see what we can do for you?
Yeah, that's a great question. So what I like to do is obviously start off with taking a very thorough history and exam, because that helps me to get the patient to tell me more about what's going on rather than just, I have pain here. It's important to know not only where the pain's at, but also what type of pain is being felt. Is it sharp? Is it dull? Is it achy? Is it knife-like? Does it travel from one spot to the other? Does it involve also painful or non-painful numbness and tingling? Mm-hmm. So finding that out is really crucial to knowing exactly what could potentially be the cause.
And is there a difference for whether it's new onset pain or someone has waited years and years to come to you as far as a prognosis or what you can do with it?
Yeah, absolutely. Obviously, my recommendation to all my patients is if you feel pain for more than 5 days, that usually is your body trying to tell you, hey, there's something more serious going on than just maybe a sore muscle, or you may have, pulled something, especially this time of year doing yard work or, in the pool, something like that. There's something deeper going on. Now, as far as long-standing pain compared to short-term pain, so it can actually go either way. Sometimes that long-standing pain gets worse over time. Other times it just stays pretty constant. But that's been your body's way of saying, hey, I'm really trying hard to get your attention here. Mm-hmm. And I have seen it time and time again where they're like, yeah, it comes and goes and it feels okay, but then they end up in my office because they suddenly had everything just blow up. Right. And when it blows up like that, usually it takes longer to resolve the pain rather than shorter.
Right. Well, a lot of time too, I'll have patients who say, well, everyone has stupid advice for me, like eat better, be active, and then this debilitating pain. And when I tell them, I was like, well, I'm sorry, but medical science, we also have stupid therapies for you. You're going to have to visit a chiropractor all the time.
Yeah.
You're going to have expensive medicines. You're going to perhaps need opioids where everyone's going to judge you. It's hard to get your refills. You're in pain management, which is really strict. Like, we don't have great ways to treat pain. So you might as well start with all the stupid methods of having an anti-inflammatory diet, maybe adding some supplements, staying active. So, because I do feel there are some disorders where you take a pill, you're better, there's no judgment, that's fine. Like, we're done here. We don't have to earn our way to health. But there's others, and pain is one of them, where there aren't really easy methods. So you do have to do whatever you can, whatever is on you to get better.
I completely agree with that. And
Sorry that I called going to the chiropractor too often stupid.
You're right.
I think you understand my point.
I've heard a lot worse, believe it or not. So, and you hit on a very good and important topic. You know, a lot of people, when they feel pain, their first instinct or their first method of treatment is take a pill. You know, taking the pill to numb the pain, to numb the senses. A lot of times it's a physical problem that is causing the pain, whether it's a misalignment of the spine, it could be traumatic, like from a slip or a fall or a car accident. It could be, you know, from sleeping incorrectly or picking something up incorrectly as well. So the first inclination is to take that pill, which is a chemical solution for what tends to be a physical problem. So it should really be reversed in over 90% of the cases. Fix the physical problem, assess things physically, and then if that doesn't resolve or it gets worse, that's when a chemical solution may help to get rid of the pain, or at least help further the healing along.
Right. No, I understand. And usually unfortunately for me, am the opposite, where I'm like, well, no, I have to earn my health. So, you know, I'll play basketball for 2 hours at church every Saturday morning. And I made an agreement with my wife, as long as I don't complain about the pain, I can do this to my body, even if I don't do any other exercise. And then I realized, well, if I take a Motrin beforehand, I'm fine. So then it was that issue of like, well, do I need to earn my health? I've got plenty of supplements. And in the end, I was like, nope, this takes care of it. And I take one Motrin about once every month or so, so I'm fine. But of course, those aren't the people that we see, because they're not fine. Otherwise, they wouldn't come to see us.
That's true.
So again, that's where I think the lifestyle changes have to come in. If you tried one specialist recommendation and it didn't work, well, you better start doing everything you can in your power. So I think that's a fair way to do it, because again, all of us are humans. So do we want to do a lifestyle change as a first option? Most of us don't, honestly. But that's a good way to think of it. It's like, okay, the very easiest solution did not work. I better do everything that I can.
I like where you hit on that too. You know, the words lifestyle and change really go well together. And yes, it is a change. And you and I both know how hard sometimes it is to change those long-standing habits that have been going on for years and years. We also hit on a good point that there is a level of responsibility that the patients have to take for themselves. You know, us as, you know, clinicians and practitioners, we can only do so much, you know, within our office. There has to be a level of that responsibility that the patient needs to take on themselves to help make sure that the care that we're giving them is the most effective.
Right. And there's no judgment with it. It's simply that with lifestyle changes, you'll need to see specialists less often. So just more of your own time and money. And I think we all make those value choices every day. So, and I think those value choices are best done without shame or judgment. Sort of like if you're so I had a friend who was gluten-free, so they went to this Christmas cookie exchange. They're like, I'm gonna have some gluten, but you know what? I'm gonna have the best gluten. So I've got to decide which of these cookies are worth it and which of these are trash. And I was like, that's actually a really interesting philosophy.
Yeah, you know, one of the things that I learned growing up from my chiropractor and some of my mentors was, you know, you got to be able to enjoy life. So they said, try your best to follow the 80-20 rule. 80% of the time, make the right choices, do the right things. Get a healthier diet if you can. You know, do exercise if you're able to. 20% of the time, hey, have fun. If you've been doing really, really good, reward yourself with a treat, or you know, a slice of pizza, even though it has gluten, or something like that, that can just make you feel like you're not this robot and you're not stuck inside this box all the time. Yeah, because otherwise you'll make them better with your chiropractic care, and they'll have to come to Ascent Health Center for mental health care because of that singular focus on, I must be 100%. My worth comes from being healthy physically and that sort of thing. Because I have those conversations all the time. Like, look, we could do this and it'll get you another 10% better, but honestly, I don't think it's worth your time or money.
So, and I think that's an important conversation to have, because that's a big part of self-worth and valuing yourself, that, you know, I'm fine, and this is, you know, I'm healthy enough to do what I need to do, and that's where I'm going to go. So, absolutely. Great. I really should stop doing 3 shows in a row and value myself a little bit better. But my last thought of pain is, so we've already said, okay, you might have to see me, we might have to see you. There's some mental health things you can do for yourself too, even counseling and therapy, which sounds ridiculous, like, no, it's physical pain. A lot of times that can unlock either some hidden trauma, or again, I guess I can't say this enough times, the medical solutions for pain are stupid. So you have to do everything you can, even if it sounds stupid, before you start having RFAs, or I've done a lot of anesthesia work for pain management. And absolutely, sometimes it's needed, that's all it is to it, just go get your surgery and stop being in pain. But because the ways of treating pain are difficult, even if something sounds silly, you do need to investigate it. And when you investigate it, you also have to find out, well, maybe this isn't the path, because I've had patients, you've had patients, where it's like, nope, you're not better. This isn't the pathway to get better. You need to try something else. So sometimes those failed attempts, whether it's a ketamine infusion or getting your back adjusted, that's useful too, because it tells us, okay, this is a road we don't need to travel. Let's back up and try this path.
I agree. And, you know, that's why it's important to also have a clinician or a clinic that has, you know, multiple therapies. So that way it's not just a one shot and, oh, then we don't know what to do at that point. So
Right.
I really like how you touched upon how, you know, the mind can actually affect or cause pain in the body, which is known as the psychosocial or psychosomatic aspect of pain. So you touched upon, you know, the ketamine infusions, or some of the things you do at your office.
Right.
So in my office, we do a form of biofeedback where it measures the pitch of your voice. And it finds where the voice is out of tune or out of alignment, like your spine can get on a musical scale. It actually can find either a current or past stressful or traumatic events. And then you listen to audio clips, which has the opposite tone. Really nice overlaid music too. It's very gentle, very soft. A lot of people liken it to meditation music. And that is a good way of just helping that, you know, those stressful events, and helping your body work through it on more of a subconscious level. And I've had really great results with patients that have come in to use it.
Absolutely. And I think, again, I wonder if we could name this show like pain treatments are dumb or something.
Right.
Because that's what we're
Alternate
saying.
treatments to
Because I've
pain.
looked at so many of those, and you're talking about quantum integration, and at first someone's going to be like, well, that sounds dumb. It's like, well, you know what else sounds dumb? Being on the toilet all day because you're on opioids and you're really constipated. So again, you have to look at the alternatives of, okay, what do I have to lose? And I'm sorry that every single show talks about this,
Right.
but we all have limited amounts of time and money, and so we don't want to waste them on things that aren't going to work. And so sometimes it is as simple as, this isn't expensive. It sounds dumb. If it's going to help me and I don't do it, I'm going to feel really dumb. So where do we find that limit for patients of, look, you can't try every single thing, but how can we focus on the things that certainly aren't going to make you worse?
So really good question there. So
And sorry again that all my questions are so long.
That's all right. You know, my take is, you know, that's where I think also the history taking, the exam, making sure that none of the bases are missed is going to help keep them or even direct them onto that path of, this is the proper treatment for you. This is one that's going to be the best. And again, just like you have at your office as well as mine, having multiple methods to try should one fail or not produce the results that the patient should be seeing, should be progressing, as well as the way that we feel they should be too.
Yeah, I get that question a lot. Like, how are you as a nurse anesthetist working with psychotherapists and a psychiatrist? And that's why I tell them, like, well, sometimes it's one of our turns. It's like, you're up. And because we have very separate lanes, it allows a lot of crosstalk that's usually not possible. So yeah, absolutely. And I think you kind of hit the nail on the head where, again, sometimes it is just having your back checked out or doing your typical chiropractic care. And other times it's like, well, no, especially for someone who's had a lot of surgery on their back, that's where something like quantum integration might be more useful. It's like, no, everyone's already worked on your back and you're still in pain, so maybe that's not the key here.
Sure. You know, there's multiple different avenues. I mean, there's so many different alternative treatments out there that even I lose track of them, or I'll go over, you know, hear somebody mention one, or I'll go through a list of seeing ones. I'm like, oh yeah, I totally forgot that one was available. So, and that sometimes is the one that is missing in a patient's care that I've been thinking about recently.
Yeah, and to finish up that talk too, I think it is important to try to get some clues on, well, what if a treatment is really stupid? How can I tell? And obviously we're not going to have great answers here because the whole point is it is very patient specific. So you can Google some options for yourself, but certainly you need to talk to a provider about which ones might be right for you. For me, a lot of it is if it's too glamorous, honestly, if it's, you see this in supplements all the time where there's some gold foil wrapped supplement bottle that's MLM and it's like, wow, $50. And then you're like, I saw these ingredients at the Great Value brand for the same thing. So sometimes it is, if there's too much marketing spent, then maybe like they spent all their time on marketing and not on research. So that's one way for me at least that I can sort of tell, you know what, this just looks too good to be true, or it's too fake, or it might be something I've never heard of, but it's packaged as if like everyone in the country needs this and they're going to get better from it.
So I agree with you on that too, especially touching on supplements. You know, it seems like everywhere you turn around, people are talking about supplements or trying supplements. And, you know, we're constantly seeing, you know, try this in the vitamin shop, you know, and other grocery stores. And you touch upon, you know, one of the brands. And one of the things as a chiropractor that I have found is not only is brand important, but the quality is important. So a lot of supplements, they get things either from overseas where they may not have as much or as strict of a protocol for testing to make sure that the right things are in there. So, and that's why, you know, finding a practitioner that is really knowledgeable on supplements, not just from them taking themselves, but has seen success in their patients with certain brands and certain, you know, high quality supplements is super important because, you know, I have a saying, you know, garbage in, garbage out, and that goes with not only food, but also supplements. What you put into your body's going to utilize, and it's going to incorporate that into all your cells. So if you're taking in something that isn't high quality, it'll actually produce, you know, low quality results when you take it. And
sometimes too, if an office offers you something right away, like before you even trust them, like for example, when we do ketamine infusions, it's a very intense experience. And what we prefer is to have a patient for a while, and then over time, like, okay, you know what, this medicine failed, it's time to try this. So if somebody comes in, they'll be like, oh, you really need this expensive program. This is gonna fix you. You're like, you barely know my name. You just met me. So sometimes it is wait until there's a trusting relationship. And the way healthcare is today, like it won't take you long to figure this out. Like you're not gonna need a year worth of visits to be like, okay, I trust you. We'll go ahead and do the quantum integration now. But, and this has to do, of course, with, you know, if you find something on the internet too, if you have a trusted relationship with a provider, if you feel that you're on the same page, you're not in it for the money, they really want you to get better, then it's more likely like, okay, I will give this a try. So, and sometimes, like I said, it's perfectly fine to be like, well, wait, let's try something conventional, let me get used to you. And then over time, we'll see if all those get exhausted, if I'll try the exotic flavor of the day or whatever it is.
All right. Do you have a lot of patients also come to you asking, you know, hey, have you heard about this, even though it's something you don't offer in your clinic, just to get your opinion on it?
Yeah, and so, and I usually tell them like, oh, I'm really smart about this, or like, I did a Google search just like you did, and here's my opinion. So they have a sense of how wise my opinion is going to be. And then I think now, with the addition of you, of course, I have about 800 different providers in just Northeast Ohio. So it's like, well, this is a specialist on this. Because I think that's a challenge too, because both of us deal with kind of confusing diagnoses. Well, someone, is it fibromyalgia? Is it PTSD? What exactly is going on here? Is it mental health, physical health? It does help to have a long list of people that they could see. And some of it does depend on, okay, let's say they go to you and they're not using insurance. Well, if you're gonna come to me, then let's try something that is insurance-based. Again, because sometimes if you split all your resources between multiple specialists, it's almost like going to a buffet and just having like one bite of everything. It's not really gonna work.
Right, you touched on the point, you know, it's great for your practitioner, whoever you're seeing for whatever ailment, whatever pain, whatever health condition. You know, it's important to know that they have a long list, or at least a good list of other practitioners to do in conjunction with care, or if, like we touched on this whole show, saying, hey, you know, this may not be the right fit either right now, or, you know, we may need to do it later down the road, but we need you to try this avenue, you know, to make sure that we're still staying on the right path to getting you better.
And the freedom for patients to come and go. I have some patients who like I won't see for a year and a half, and they'll come back, put them right in, we fix them back up, send them on their way, and that's perfectly fine. Because otherwise, to expand on my terrible analogy of the buffet. Like, so you have one bite from all the different troughs at Golden Corral, you're still going to get food poisoning if you choose one wrong. So the challenge with multiple specialists is that you could still get your back jacked up. You still could have the deleterious effects of someone who doesn't know what they're doing, and you're widening the scope so much that any potential benefits you could get are so diluted from all these different specialists that all have given you different diagnoses. Like I said earlier, I went to the dentist today. I'm sure most problems that I have, they would attribute to my oral health or my teeth. You know, if I go to you, you're a chiropractor, there's going to be something with those joints or bones. So it does take a grain of salt with that too.
Sure, you know, more than one way to skin a cat, right? It's an age-old saying, and that involves, you know, not only multiple areas of life, but also when it comes to your health and healthcare too.
Yeah, well, cats need chiropractic care too, I'm sure.
Yeah.
Absolutely. This is probably a good place to end the show since we're about to talk about chiropractic care for cats.
They do have spines and nervous systems, so yeah, even there are animal chiropractors out there.
Oh, I bet. That's awesome. Well, I mean, if you have an organic cat, okay, let me focus. If you need mental health, you can come to me at ascenthealthcenter.com. We will set you up with a counselor or a psychiatrist. If it looks like something that works with my expertise as a nurse anesthetist, you'll see me as well afterwards. If, on the other hand, you need some chiropractic care, how can they reach you? So
one of the best ways to reach me, obviously, is the, you know, tried and true, giving the office a call. So that number is 234-334-7770. Highly recommend anybody looking for chiropractic care to see if I'm a good fit to check out my website, which is integchiro.com. They'll be able to see a list of things that I can help with and more on there. Plus, they can get more information about the quantum integration, about the biofeedback that I offer. They also found out that I do custom orthotics, where I take a mold of the feet, because the foundation of the body is off. Well, the rest of it is going to be off, just like in a house. Absolutely. So making sure that from the ground up, everything is sound outside the office. The spinal decompression is great for disc issues with a herniated or bulge, or that sciatica pain. It can help with that too, as well as many other methods that I offer.
Great. Well, thank you all for joining us for the Ascend Health Show.
You are watching WCTV, Wadsworth Community Television.